Hi, I'm Frank Diamond, the managing editor of Infection Control Today. We hope to give infection preventionists and others on the front lines the information they need to battle COVID-19. Many infection preventionists have a nursing background, and my guest today is Dr. Ernest Grant, the president of the American Nurses Association. Google Dr. Grant. His is a fascinating life story filled with many awards and accomplishments. To name just one of his accomplishments, in 2002, President George W. Bush presented Dr. Grant with a Nurse of the Year award. Dr. Grant got that award for his work treating burn victims at the World Trade Center site after the 9/11 attacks. Like I said, a fascinating biography. One last point. He's the first man to be elected president of the American Nurses Association, an organization whose goal is to uphold and advance nursing standards in this country, throughout the nation. Dr. Grant, thanks for visiting the Infection Control today.
Thanks for having me. Happy to be here.
Now, you seem like the type of person who takes on the tough challenges of any given moment. And of course, the tough challenge of this given moment these days, for the last months, is COVID-19. Now, do you see the pandemic as changing the way nurses do their jobs, or changing the way infection preventionists who have nursing backgrounds for the most part do their jobs?
Absolutely. It has changed the way nursing has begun to not only view their jobs, but also how they take care of patients. And also the profession itself will be changed once this crisis is over as a result of COVID-19 in a number of ways.
Well, in what ways?
Well, first of all, the first thing we're noticing is obviously the preparedness for, when a pandemic such as this comes along. One of the things that we're anticipating is that, COVID-19 is just the latest of, perhaps future and more frequent occurring pandemics. So being prepared for that or for future pandemics is very high on the list. The other, of course, is the way that we will be prepared to provide care for the patients also. One of the things that COVID has taught us is that not only with using the PPEs and things of that sort, but also just, modifying teamwork, going in and caring for, the very critically ill patient. And it's, of course, is having quite an emotional toll on nurses who are seeing so many deaths per shift. If you're working a 12-hour shift, there's a possibility that you may see anywhere from 6 to maybe 16 deaths occurring on your unit because of how critical the patients are. And that within itself creates quite a problem for the patients.
And especially seems, one of the most telling things about this pandemic or heart-wrenching things is that a lot of times it's the nurse with the patient. The loved ones can't get to see the nurse. That has to, as you said, be an emotional toll.
Absolutely. The nurse is playing two roles, if you will. One, and that's another aspect that has changed, is that you're also being the family member. You're there either, holding an iPad so that the family member can view their the patient, or the patient can communicate with the family member. You're keeping them updated on their progress, whereas in the traditional method, I guess, air quotes there, the family member would be there in the room and be able to actually visualize what it is that you're doing and how the patient is progressing. So you have to set aside that special time, several times a shift, I'm sure, to contact family members and say, give a progress report. And of course, that's time that you're having to take away from the patient. But that is still critically important because, that family member, their encouragement, words that they can send to the patient also helps to determine whether or not this patient is going to, recover or not, or give them the incentive to want to go on and have a speedy recovery.
As I mentioned, a lot of my readers are infection preventionists, and a lot of them have nursing backgrounds. How does a nursing background feed in to the job of infection preventionists?
Well, as nurses, we're taught to look at the whole body as well as the environment, and we take that information and also try to personalize that, if you will, for the patients that we're caring for. We try to get some idea of, how was this patient before this illness struck, and what are some things that, that will that we can design the plan of care for this person that is unique to them, even though the same person in the next bed or someone else in the next bed may have the exact same illnesses and et cetera. They're going to be treated differently because of who they are and where they, their life's experience and et cetera. So in a way, as a nurse and as an infection control person, you're sort of playing the detective, so to speak. And by doing that, then we can obviously be prepared to, highlight our care for that one, specific patient that is going to help them to get over that particular hump. So taking in the environment, knowing that, they may have got infected, perhaps attending maybe a birthday party or being out in a very heavy crowd or things of that sort. Those are some things that's going to also help to drive their care and help us to to get a better picture of who it is that we're caring for and how can we what can we plan that's going to be the best for them.
It seems from other infection prevention experts I've spoken to that infection preventionists also have to look out for their healthcare colleagues. Does a nursing background help in that way? I guess if you're a nurse manager, it helps in that way, right?
Oh, absolutely. It's one of the things you have to think about is, someone may be in a patient's room for several hours, doing various nursing duties and tasks. And so you want to make certain that this person at least gets some sort of relief, so that they're not overwhelmed or they're taxed. So we have to look out for one another and look for those little subtle signs that, this person may need to have a tap on the shoulder and say, why don't you take a time out, go have a bathroom break, go have a Coke or, get some lunch or, something like that while I watch the patient for you, because it can be very, very demanding. You've got a lot of technology equipment that you're dealing with. That is helping you to take care of this patient. You've got to interpret all that data and of course be prepared to present that to our physician colleagues or our advanced practice nurses who may be helping to care for those patients as well. And so that you're ensuring that the patient is getting the optimal care. Failure to do that, obviously you're going to have a nurse who is very tired, who is, and studies have shown that when we're tired, there's the increased chance of, the possibility of errors happening. And of course, we want to minimize that as best as we can. So by recognizing that, yes, this person needs some time out, they perhaps need to have, a mental health day or refer them to some mental health resources because, keep in mind, this crisis has been with us now for about 8 months, and we don't know where it's going to end. Most crises or disasters, usually we know where they're going to end in about 24 to 48 hours or so. Everybody comes in, they triage and, and then go. Here, we don't know when this is going to end, even though there's promise of vaccines down the road. That still doesn't mean that this crisis is going to be over. So until we can see the light at the end of the tunnel, it's very crucial that we look out for one another and make sure we address our mental health and emotional needs.
When the COVID-19 vaccine comes along, do you think that getting that vaccine should be a condition of employment for nurses?
That's a very tough question, but obviously it probably will be. I do know that in the majority of the healthcare institutions around the country, the flu vaccine is a requirement for for healthcare personnel, unless there is some religious objection or some other reason that they cannot take that. So yes, I would say that it probably is going to be part of a requirement for employment that person gets that, unless there's some other some reasonable objection that they may have. Back in March and April, it seems like every day we were learning something new about the virus. So obviously the questions surrounding those, and also the policies and/or procedures, if you will, providing the care to the patient would change as well. And in some cases, some of the questions have not changed, such as, we're still hearing from nurses that are on the front line that there's still a lack of PPE, or personal protective equipment, particularly the N95 mask that is so desperately needed. We are working with the COVID-19 task force and other areas of the federal government to ensure that the supply chain is kept up to date, so that the desperately needed supplies and other pieces of equipment are gotten to the places where they need to be, so that again, life can be a little bit easier for those frontline workers. Patients will be on the ventilator, they would just be on their backs. Now we're finding that it's they have better results by having turning the patients on their stomachs. Helps a lot. Different medications that we may try, steroids, as well as the remdesivir, helps quite a lot with the recovery. And so again, as those are done, your nursing care is going to change as well, because obviously as the patients are getting these medications, you need to be on the lookout for any particular potential challenges that they may have. Is the person having an allergic reaction to that? And the sooner we're able to catch it, the better it's going to be. And also, obviously, from infection control, again, just making certain that everyone that goes into the room, that they're properly gowned, masked, and gloved, and wearing the correct equipment. And then also when they step out of the room, that they take the equipment off in the correct order also, so that you don't run the risk of spreading that the virus to your colleagues, or worse yet, potentially taking it home to family members.
What do you see as the main challenge going forward for nurses?
I think the main challenge going forward is the fact that, again, not knowing when this crisis is going to end, and nurses still having to face just so much death day in and day out on their shifts, and the potential mental anguish that this is going to cause. And they're not seeking the appropriate assistance that is offered, to help deal with that. We are great at caring for patients and others, but sometimes when it comes to caring for ourselves, we always put ourselves last. And in this case, they need to, the frontline workers need to recognize that it's important that they take care of themselves first, because you've got to operate at your optimum, and in order to take care of all the other challenges that's going to come along. So you're not going to be very beneficial if you yourself are not at up to par.
Any final words of advice for either nurses or infection preventionists?
Well, I would say for the nurses and all the frontline workers, thank you for all that you're doing day in and day out. We will continue to advocate on your behalf, with trying to ensure that you get the proper equipment and such that you need. And for the preventionists as well, or infection control folks, again, it's extremely important that we continue to study this virus, and of course make changes to our standard of care or standards of practice accordingly as we find out new information, and get that education out there as soon as we possibly can.
Dr. Ernest Grant, thanks so much for visiting Infection Control today.
Thank you very much. Happy to do it.